So my name is Emma, and I was in a group with Lexi and David, and today I'm going to be talking to you about major depression disorder. So what is it? Depression is a type of mood disorder that causes persistent feelings of sadness and loss of interest. Depression is a chronic disorder that affects day-to-day activities and is not just feeling sad. Depressive episodes are when symptoms get much worse, and that's when symptoms are noticeable. So symptoms: feelings of sadness, tearfulness, emptiness, or hopelessness, angry outbursts, irritability, or frustration, loss of interest or pleasure in most or all normal activities, sleep disturbances such as sleeping too much or sleeping too little, tiredness and lack of energy, reduced appetite and weight loss, or increased cravings for food and weight gain, anxiety, agitation or restlessness, slow thinking, speaking, or body movements, feelings of worthlessness and guilt, trouble thinking, concentrating, making decisions, and remembering things, frequent or recurrent thoughts of death, suicidal thoughts, and attempts of suicide or suicide. Unexplained physical problems such as back pain or headaches. And then it's important to remember that each age group has different set of symptoms. So for younger children, symptoms can include sadness, irritability, clinginess, worry, aches and pains, refusing to go to school, or being underweight. In teenagers, symptoms can include sadness, irritability, feeling negative and worthless, anger, poor performance or poor attendance at school, feeling misunderstood or extremely sensitive, or using recreational drugs or alcohol, sleeping or eating too much, self-harm, loss of interest in normal activities, and avoidance in social interactions. In adults, memory difficulties or personality changes, physical aches or pains, fatigue, loss of appetite, sleep problems, or loss of interest in other activities, often wanting to stay at home rather than going out, suicidal thinking or feelings, especially in older men. So causes: it's not exactly known what the exact cause of depression is. Some scientists discover that biological differences could be cause of this. So people with depression appear to have physical changes in their brains. The significance of these changes is still uncertain, but it may help eventually pinpoint the cause. Brain chemistry: so neurotransmitters are responsible for how your brain reacts to things. So normally occurring brain chemicals would likely play a role in depression. There's a new research study that suggests that neurotransmitters, how they are wired, can affect how the mood is stabilized. Hormones: so changes in the body's balance of hormones may be involved in causing or triggering depression. This is especially relevant in pregnant women or postpartum women. Inherited traits: so depression is more likely if you or a loved one also has depression, and it tends to follow bloodlines. So diagnosis: your doctor is going to do a physical exam. They're going to run some lab tests so they can test your thyroid levels and your CBC levels, which is your complete blood count. Psychiatric evaluation: so they're going to ask you questions about how you're feeling, what you do every day, and then the DSM-5. So the DSM-5 is a list of depressive symptoms. The doctor will ask how often you feel these symptoms within the last 2 weeks. The individual must experiencing 5 or more of these symptoms within the last 2 weeks, which must include a depressed mood and loss of interest. So treatments: there's a lot of treatments for depression. There are many medications. Your doctor is probably going to start you off on the SSRIs, and then we're going to see what works best with you. So everybody is different. Everybody needs a different treatment. So there's tons of different medications that work in a different way. Psychotherapy is important, so you can make a goal about how you want your life to be, and you guys can work through it together. Explaining how you feel is often very helpful for depressive symptoms. And lifestyle changes: so as hard as it can be, getting up and being active, being organized, getting things done during the day can really help ease off the depressive symptoms. And then spiritual changes: whatever works for you. Going to church, finding something that gives you a higher meaning is also really important for depressive symptoms. So PSA: it is important to learn the warning signs for your depression so that you or a loved one can be aware and take action before it really sinks in. Sticking to your treatment plan is very important. If you're on medications, don't go off them, because you can get your depressive symptoms back, or you can even go through withdrawal symptoms. Pay attention to you or your loved one's warning signs. It's different for everybody. Some people start being isolated, some people start being irritable. It's important to recognize that and start getting treatment and help right away. Avoid alcohol and drugs if you're struggling with depression. These often make things worse. Avoid isolation. It's important that you're supportive and you have support when you're going through depression. Understand that a lot of your negative actions, if you are depressed, are symptoms of depression, and it's important not to hate yourself or even feel worse about them, because they're symptoms of your depression and they are often not controllable. So have patience with yourself and seek help. Follow-up and prognosis. On average, a depressive episode lasts from 4 to 6 months. With treatment, duration can be 3 to 6 months, and everybody is different. Depression can be a lifelong struggle, and with good episodes and bad episodes, it is important to find a quality treatment and seek help to avoid suicidal thoughts or behaviors. Depression cannot be cured. Depression remission is the goal, and remission looks different for each person. And that's all I have for you.